Good day, everyone. My name is Alyssa Strambler-Rios, and I'd like to talk to you a little bit today about mental health and recovery and what it means, which can mean very different things to different people. This topic is very personal to me because I have a history of family members who suffer from both mental health and substance use. Mental illness is prevalent in the U.S. Overall, the goal of psychiatry is to improve the treatment and outcome of the treatment of mental illness. The U.S. had the highest number of suicide deaths ever reported in 2022, and nearly 60 million Americans experienced a mental illness in the past year. Mental illness and substance use are similar, but also different. While mental health is considered a mental health disorder, recovery from each disorder is somewhat different. What is recovery? And what does it mean if we are in recovery? For substance use, the National Institute of Drug Abuse defines recovery as when people discontinue the use of drugs and return to productive lives. However, a person can discontinue drug use but still not be ready to be productive and can also be productive while still using drugs. Clinical recovery for mental health disorders means different things and does not always mean without symptoms. Clinical recovery can be a measurable decrease in symptoms to allow the patient to return to their usual activities and can be either short or long term, both. Personal recovery and personal recovery adjustment and development is where the person overcomes the negative and personal effects of the mental health disorder, which gives them a better chance of self-determination and a meaningful life. Hope is experienced as the embodiment of having a sense of possibility in life. It drives motivation to seek treatment and overcome challenges. The theory makes perfect sense. If a person does not believe they will be okay, will their sense of safety and connection be at risk? I think so. While hope is important in mental health recovery, how do providers and clients work together to achieve it, and what barriers prevent the progress? What would hinder an individual from feeling safe and connected? What does it take for a client to say, I will be okay, or realize they are improving? One study determined that mental health recipients had three important factors that gave hope. One, access to care. Two, staff competence and wisdom. And three, caring interactions. There are no cookie cutter treatments for mental health, and since everyone is different, treatment needs to be individualized. The World Health Organization Comprehensive Action Plan of 2020 to 2030 provides an international framework to assist with prioritizing and implementing an individualized, person-centered, rights-based recovery approach to mental health, promoting equality, non-discrimination, community inclusion, and legality for recovery. The World Health Organization has specialized recovery training for managers or other professionals, families, healthcare workers, or clients to discuss person-centered recovery approaches and supports and explains what getting better means as it's different for each person. Not all clients seek help, and to assist clients with their own personalized recovery plan, the World Health Organization has equality rights, person-centered recovery planning for mental health and well-being and self-help tools as well, so that individuals can set up recovery plans for themselves. Family. For addiction recovery, there is evidence that clients who cohabitate with partners or have dependent children are more successful at achieving recovery. Having more than one trusted person in their social circle suggests a greater chance of true recovery. Some barriers for clients to receive recovery-oriented care can consist of attitudes, skills, system issues, or knowledge or lack of knowledge of frontline staff, while essential factors of success were creating safe, relational, and healing spaces for the individuals. There's no question that stigma or disgrace can be associated with those who suffer from addiction, whether it's self-stigma from the client or the public. Mental health disparities are apparent as stigma seems to be higher in cultural and ethnic minority groups of Asian, Black, and Latinx Americans compared to white groups. The language used to address those who struggle with mental illnesses may encourage or discourage a client's decision whether they will seek help and reduce the client's perception of stigma. Even with educational advances of healthcare providers and caregivers, sometimes it can still be taken as derogatory. For some families and cultures, a mental health diagnosis can feel like a death sentence. Should we use mental health or behavioral health? Do we address individuals as patients, clients, survivors? All questions are important when we're deciding how to address others and bring them in to seek treatment. Nurses are essential to recovery and mental health services concerning individuals, knowledge of treatments, fostering hope, and believing that recovery is possible. Hope-inspiring competence training is an important advanced practice that gives motivational resources to improve the chance of recovery. Mental health nurses and professionals must be competent in promoting service user hope. Mental health recovery is a preferred outcome of individuals, and hope is listed as a key promoter of recovery. As nursing professionals, we must try to recognize our own, the individuals, the families, or the public stigma to assist in our clients' recovery and provide a safe, rational, non-biased space to give the best chance or sense of hopeful recovery. Thank you for your time and attention. References.